Hi, I'm Grace Wright.
I am Dr. Michael Schweitz.
I'm Sarah Jody.
I am Michael Kaluva.
I'm Rosemary Ainley.
My name is Carlos Caballero.
My name is Judy Nagy.
I am Cristina Montoya.
Hello, I'm Ana Vieira, and I'm a beacon for better health.
I'm a beacon for better health.
I am a beacon for better health.
And I'm a beacon for better health.
And I'm a beacon for better health.
And I'm a beacon for better health.
And I am a beacon for better health.
And I'm a beacon for better health.
And I'm a beacon for better health.
I went up to Alaska because I grew up in a rural community and sort of understand some of the challenges that come with accessing healthcare when you live outside of a city, and just really fell in love with the communities up there. The rural communities have their own challenges and also their own opportunities, and it's been great to be able to care for people from a spectrum of backgrounds, cultures, ethnicities, and provide rheumatologic care.
People often say there's a life before my diagnosis and then there's everything after. And my goal is to help people recapture the life that they had, even if we have to modify things, but to really be able to enjoy and live life to the fullest capacity that they have.
What motivates me to help others is I got help myself when I first started. I wanted to help others find that same experience of actually just finding kindred spirits, whether or not it was in person or by sharing information online with them.
What motivates me primarily is personal satisfaction in seeing a patient get their health restored and get back to normal function, relieve their pain. All those things are terribly satisfying personally. And I think it's true for most physicians.
Well, when you are told that you have this condition, that there's no cure for that, and there's not even treatment, the last thing you think about is to stay seated on your couch. You want to research, you want to look for solutions, you want to travel the world to find answers that you can't find in your country.
I think what motivates me to help patients, when a patient goes to a doctor, is because they have a problem that requires some solution, and sometimes we manage to solve the problems, other times we manage to control it, and we always try to help the patients to overcome their chronic conditions as best as possible. So we want to help, always.
My proudest moment would be, I think, that first fashion show that I did with Creaky Joints and coming out with my story. It was really an eye-opening experience of how amazing everybody is and how they really took the news and were able to be compassionate. They were also very inviting for me to keep on going and supportive of my career. I was so worried all those years about being kind of shunned out of the fashion industry at such a young age and not being able to regain my control and be able to live out my dreams. However, it just really just pushed me forward and made me stronger.
As the administrator of a group Facebook page for patient advocates, Creaky Joints Patient Advocates, I have members all over the world, and I frequently speak to people in other countries and help them to navigate through their own resources wherever they live, which is even more rewarding because you learn that you are not in a bubble. We're all in this together, and it's global. They're global problems that we're dealing with. I have a guy in Pakistan that I talk to on a regular basis now. We're friends. He has psoriatic arthritis. I gave him all kinds of information. He got his medicine. He's doing great.
From an organizational standpoint, I'm proud of establishing a mindset in the rheumatology world that advocacy is important and is effective, so that educating policymakers and advocating for both patients and practices and leads to changes that are beneficial for patients.
I would say that when I co-founded the Sjogren Europe Federation, which is a federation of national associations in Europe representing Sjogren's patients, it's a very young organization. We were set up early in 2019. We are still a baby learning to walk, a baby crawling, learning to walk, but we've managed over these last 3 years and with the pandemic and so on to shine a light on Sjogren's in Europe.
Proudest moment as part of the organisation is probably ongoing, and it's, for me, my role as a volunteer with the Arthritis Support Group and my role as the Creaky Joints editor are very much interrelated because they both come from me, from my heart. I think my proudest moment is specifically when I see the moment of helping somebody else, when I just see the sheer relief in their face, and sometimes even crying in some of the groups saying, you understand me, thank you for understanding me.
When I think about the work that I've been doing over the past 6 years, the proud moments for me have actually been in those small moments rather than one big moment. It's, when we get a patient with rheumatoid arthritis on treatment and their quality of life improves, they're able to do the activities that they want to do, they're able to spend time with friends and family and just enjoy life. I think for me, those little moments and hearing those wins from patients are often some of my proudest moments.
I would say for people internationally, arthritis is not a death sentence. You can still pursue all of your dreams. Stay positive. I know it can be really hard sometimes, but stay positive and really just keep your goals there. You will reach them.
Well, living with chronic illness, it's a marathon, it's not a sprint. It's full of ups and downs, and it's okay to express your feelings of frustration and anger and sadness, because these diseases bring us down. But one thing I learned recently is that give yourself that 3 grace period that you're feeling down. If 3 days have passed by and you're still in bed, make an effort to get up, just to even take a shower. Eat some healthy breakfast, even if it's just oatmeal. Just make that effort for yourself, because your life is precious.
Find your community, reach out to other people. Don't be afraid to ask for help. Don't be afraid to say you're having a bad day. Don't be afraid to say you're not coping. And actually look for the support around you. And it might not be your family and friends, it might not be your doctors, but go to your arthritis organisations or your local government organisations or community health and find a peer support group somewhere. If you can't find a physical one, look online, look on Facebook, and they're on all sorts of social media, and find someone who understands you and will listen to you. And believe me, we're out there.
Treatment is individual, but healing really occurs in community. And I think that's the message that I want to get out to folks here in the US and around the world, that creating community, whether that's joining community through Creaky Joints and learning from other patients who are having similar struggles, or finding or creating community wherever it is that you live, is really the pathway to healing.
My best advice for patients worldwide is that you keep searching, you keep striving to become the best you that's possible. You find the support that you need, whether it's a healthcare provider, a friend, a family, nutritionist, exercise person, but you find your team that's going to help you become the you that you wish to become.
I guess it means that I've made my bit to shine a light on this very serious and disabling condition, Sjögren's syndrome. And overall, I think this recognition will bring again the name of the disease and all the patients behind it to the spotlight. And eventually it will capture the attention of other stakeholders who are crucial to make a better world for patients living with Sjögren's syndrome.
What it means to be one of the first beacons for better health, I feel honored. I had never done this education to get any, any credits or awards or anything like that. In my mind, it's just, I'm thinking, I don't want other patients to go through what I went through. If I can make their life a little bit easier, if they're maybe to avoid their bumpy roads, right? So it's a little bit smoother for them. I think that is my goal. And I feel honored that you consider my experience and my work to be part of these awards, I guess.
I am so proud of this organization, the Global Healthy Living Foundation, its staff, its founders, and all the people that participate in the education and the connections that help us all live a better life. And I am very, very, very proud to be one of the first of the members of this organization to be awarded with the Beacon of Health.
Well, of course, I feel very, very honored by this recognition, and it's very pleasing that this work that has been for several years is now being recognized nationally, regionally, and also globally. So it's very good. It's very nice. Finally, I have the idea that the best thing is that other people embrace the idea to work together with the patients' organizations, and it will constitute a real legacy for Panland. So we are expecting to do, we did recently the 5th Pan American Congress of Patients with Rheumatic Disease, and now we are preparing for the 6th Pan American Congress, so we are very happy.
What it means to me is I'm just one of millions of other people out there doing these things. So I'm grateful that I've got the voice and the chance to express this. But I'd really like to acknowledge all the other people out there that are doing similar things, that are actually helping out their neighbour or helping out their friend, or running a local support group or running a Facebook group, for actually doing the work that they do, because I'm part of a great community, and I'm so thankful for that. So what it means to me is that I'm representing them. It's not me with my ego, it's me representing the so many other people doing this work, and just being proud to share what this experience is like.
Being a beacon for this global platform is amazing. I have not been recognized like this before, so this is my first time being on something with this much recognition, and it's something that really feels good. I've put a lot of hard work in the past 7 years, 8 years now, and I really am truly honored to be on that really special list of leadership in arthritis.
It's a tremendous honor. I do this work because it's what I feel passionate about. It's what makes me excited to go to work every day. And so I hope that this allows me the opportunity to teach more trainees, other rheumatologists about the joys and opportunities that exist in working with rural communities?
Well, first, I guess it's flattering. Second, it's satisfying. The recognition is satisfying, and I hope that kind of recognition leads others to see that doing these things can be effective and can lead to a lot of satisfaction.
It's amazing and it's humbling at the same time. You know, you do what you do because you are who you are and you just do what you do. But to be recognized as a beacon, as a symbol of hope, of light, of a future is, for me, just awe-inspiring, and a huge thank you for this honor.
I've weathered through this unsettling storm many times before, wondering if it is humanly possible to take on any more. The crippling pain radiates limb by limb, but no one can see. The upsetting trials and discouraging tribulations weigh heavily on me. All the sleepless nights no one should ever have to face. I try my best each day to crawl my way out of this dreary, isolating place. The emotional anguish tries to capture me whole, but hope is still alive in this tender-hearted, fierce soul. A light awakens from within, weakening the tormenting dark, and refuses to let all of me go. Courage, you are my greatest achievement. I will move along the lighted path that leads me into tomorrow. From a distance, an outpouring of encouragement reminded me to breathe. You are valued. Ease away the sorrow. Somehow, this life became my fate. I will not surrender or be afraid, for I am resilient, and I know exactly how to advocate.